Hello, everybody, and welcome back for a Friday edition of Your Lunch Break with me. My name is Ivana, if you are new here, and you made it to Friday. You made it through another week. Congratulations. At the beginning of this, I was counting down like the coronavirus weeks, but we're way past that point of counting. So congratulations. You made it to Friday. I've got a really interesting talk today. Y'all have really loved hearing about the different, or not loved maybe, but y'all have enjoyed hearing about the different coronavirus cases and the trends in your county. And today I have our data reporter, Ramsey Archibald, and he's here to break this down a little bit for us and explain what is going on with our coronavirus case numbers. Now, you may have seen the story yesterday from Ramsey that talked about our record number of coronavirus cases. And that was Thursday when the Alabama Department of Public Health reported 1,129 COVID cases that had gone up that day. It had gone up by that much. And that was the highest that we've seen so far in this pandemic. So a lot of you were really interested in that. So I thought Ramsey could come on today and break this down a little bit. So I am going to put your map up in just a second, Ramsey. And when y'all see this map, the darker the blue, the more cases in that area. So Ramsey will walk us through it. But Ramsey, first tell us a little bit about your story yesterday, about these record highs, and is that continuing into today?
Yeah. So obviously yesterday's numbers were, like you said, they were a record high, but they were also like a pretty substantial increase over the previous record, like 100 more or something like that. And while today's number was a little bit lower, it was still the third highest day for new cases of all time. We had added 964 new cases today. So that's the third day in a row we've added over 950 in a day, which is the first time that's happened. So we're still kind of trending up.
Got it. So we added 964 today, and that's a little bit down from that 1,129, but that is still high.
Yeah, it's still, like I said, it's the third highest of all time. So, earlier this week, it would have been the second.
Right. Now, something else that I thought was interesting that you talked about in your story yesterday was that, and I have these numbers next to me, so I'm looking at it. Their 7-day average of case numbers of COVID cases was 708.1, just because of the average number. That's where you get that 0.1. What does our 7-day average look like today? Did today's number change that average?
Yeah, it went up again. It's up to 733.4, I think. I may have the decimal wrong there, but it's 733 basically. And that's not the highest it's been. A couple weeks ago, we had a bunch of high case numbers in a row. And I think our all-time high for 7-day average reached 780, something like that. So not 800, but like I said, we've added 950 every day for the past 3 days at least. So if we keep trending in this direction, we're on line to break that record, unfortunately.
So what is our total number right now? Yesterday, we were at 32,753 cases.
Mm-hmm. Today, we're at 33,717 and 887 deaths.
Got it. While we're waiting for y'all, if y'all have questions about your specific county, please let us know and I will get Ramsey to break it down for you. I'm going to pull up your map right here so everybody can see it. And this is, if you can see again, that darker blue, or just explain the color coding on this, Ramsey.
Yeah, so this is specifically the new cases that each county added today, or really overnight since yesterday. And as you can see, Jefferson County, which is where Birmingham is, right in the center of the state, it's by far the largest, most populous county in the state, and it added almost 149 cases overnight. And yesterday, I think it added 145. So that's like almost 300 cases in 2 days. The 149 it added today is the most any county has added in one day since the start of the pandemic. So things are really starting to accelerate in Birmingham and in Jefferson County. And its specific 7-day average for new cases is almost 100 per day. So if you think about that, over the last week, it's added almost exactly 100 cases every single day.
So let's talk about, getting a lot of questions on your counties, guys. We're going to get there in just a second. But first, let's talk about Montgomery County. So if y'all can see, I panned down, took me a second to get there. But Montgomery County today, and this is an updated map from yesterday. So this is the latest info Ramsey's put in here for us. The new cases are at 54. So how is Montgomery doing in its 7-day average?
Its 7-day average is sitting right around 60 cases per day. And that's I don't want you to get it wrong. That's a lot of cases in a day, but it's well lower than it was just a few weeks ago. Montgomery had been, way worse than anywhere else in the state, and they're the only county to ever have a 7-day average go over 100 per day, 100 cases per day, which happened, I think, last week or a week and a half ago.
I'm just looking down at my phone to look at everybody asking about their counties. So you keep talking about that, Ramsey. I'm going to look at these counties and see where we're going to talk about next.
Yeah, sure. So like I said about Montgomery, things are still not great there, but they're definitely better than they were as far as just in terms of sheer case numbers than they were last week. Now there's different metrics that you can look at, like deaths and hospitalizations. And I don't have county by county hospitalization data right now, but I can say that today, or really yesterday, the state as a whole set a record for current hospitalization. So this isn't just cases, it's people, getting really sick and having to be hospitalized. So while we have seen, like testing ramp up a little bit, which leads to more cases, it's not just that.
Right. Now somebody asked about Chambers. Let's go to Chambers. It's right over here.
It's just, to the right, south, one down. There you go.
I lived in Chambers for a little bit, so I don't know why, I can't find it. But
no, it's tough.
Chambers, guys. I think that was Amanda who asked. So you've got 10 new cases in Chambers, and that is 545 total cases there. Now, something that we've seen interesting in Chambers County and in that East Alabama area there was a very early outbreak in that area. How have they progressed in that East Alabama region?
That's a really good question. I think early on, that was like the epicenter for Alabama's coronavirus outbreak, was that little corridor right there with Chambers, Tallapoosa, and Lee counties. I would say that Chambers and Tallapoosa both have cooled off a fair amount. Like you can see, 10 cases is not a huge number of new cases in a day for a county. But Lee, on the other hand, I haven't looked at their 7-day average today. I guess it's 30, which is pretty high for Lee. They, peaked early, kind of similar to how Chambers and Tallapoosa did. But then we've seen Lee's numbers really pick up in the past couple weeks, and they actually passed that early peak recently and are kind of seeing their worst outbreak yet, just in terms of sheer cases. So far, we haven't seen that transfer over into Tallapoosa and Chambers yet, but Lee is definitely a county that I'm watching. And for people, that's where Auburn University is, and Auburn, the city, and Opelika and all that.
Right. Now, some questions about, let's see, we're going to go trying to get everybody's numbers or everybody's counties they want. Let's go to Madison County and let's go north. So somebody asked about St. Clair. We'll just quickly show you St. Clair, new cases there over today. And that is for today. That's 9 cases. They've had 2 deaths, 237 cases in that county. So let's just go back up to Madison and to Marshall. We'll talk about Marshall because Marshall has been an interesting one to watch. But right now, here's Madison. There are 46 new cases today, over 800 total, and 6 deaths. How are we looking in Madison County, which is where the city of Huntsville is located?
Yeah. So as far as Alabama's largest counties, Madison is one of the top 4, and they, compared to those other 3, they have had the smallest number of cases, and that's still true. They're not adding cases at the same rate as a lot of the other large counties. That being said, they have added more cases recently than they have at any other point in the pandemic. And it's accelerated a bit. I believe that 7-day average for Madison of 30.7 that you see there, I think that's the highest it's been there since the start. So it is, if you just look at Madison County in a bubble, it is having its worst outbreak yet, but still compared to pretty much, well, definitely all of the other large counties in Alabama and even some of the smaller ones, it's not at those levels right now.
Now let's talk about Marshall. And Marshall has been a county that has spiked in the last day or so. Can you tell us what's happening in Marshall County?
Yeah, they've a local hospital official there said that cases were out of control there, which is not a great quote to hear if you live there. They've added, as you can see, 42.1 cases per day in the last week or so, which is higher than a lot of much larger counties. As far as counties with fewer than 100,000 people in Alabama, Marshall has by far the most cases in that group. And it's hard to say, where these are coming from. It could be community spread. It could be tied to, some kind of group gathering. We don't know that right now. But it's definitely worth watching. And, I would be careful if I was living in Marshall County right now.
Right. We're going to check Tuscaloosa. There's several of you asking 56 new cases in Tuscaloosa. That is almost 1,800 total cases and 35 deaths. So that's Tuscaloosa. I know there's several of you asking. I will leave the link to Ramsey's reporting in the comments here. So you can check back up and he will let you know when he posts new stories. You'll see it there. And also this map, he's updating this every so often. And so you can get that latest information through this interactive map. I want to answer a couple of questions we're getting, and I'll go back to the map if y'all want to see it in a minute. But a couple of quick questions that we're getting, and this one is from Cherry, and I think this is a good question. Are the numbers for Jefferson County including the hospitalized at UAB? Because we have patients from all over the state. Ramsey, can you answer that? Yeah.
So the way that so this data comes from the state health department, and then the way that they report data is county of residence. So that means that if someone from St. Clair County is being treated at UAB in Jefferson County, the stats report that as a St. Clair County case. So it could be true that UAB has more new cases than Jefferson County is listed as having because they're treating people from other counties in the surrounding area. So I hope that answers your question.
Another one from Marion, and I think that this is something Ramsey and I were talking about before we went live because I had kind of a similar question. Can you talk about this map and the per cases versus the per capita numbers?
Yeah, for sure. And that's a good question. I often look at the per capita numbers, and what we've seen in the per capita numbers pretty much since the beginning is that the Black Belt and a lot of basically the poorest counties in the state are seeing the largest per capita rates. Part of that is because they have very small populations. But since the beginning, or since about a month into the outbreak in Alabama, Lowndes County, which is one of the poorest counties in the state, it has fewer than 10,000 people, and it's just west of Montgomery. It has had really by far the highest per capita rate of coronavirus cases. I haven't looked at the updated figure, but earlier this week it was over 400 cases per 10,000 people, which their population lines up pretty well with that because they have about 10,000 people. So that means about 400 cases there. But for a county that small, that's a really staggering figure. I think the next closest was like barely 300. So it's almost 100 more per capita or per 10,000 than the next closest. And a lot of other Black Belt counties are kind of the same. You see very similar trends. The map shows basically that Black Belt area, and then you have a few outliers like Franklin County, which is in far northwest Alabama near the Shoals area, which also spikes on that map, and a couple others. But really the Black Belt and a section including, if I can remember correctly, Dallas County, which is the home of Selma, Wilcox County, and a few others in that area are the highest per capita.
Got it. And just to clarify, this map that we were showing you, that is not a per capita map. That is just a straight case number map. Quick question from Sharon, and this is important. I don't have this number in front of me, but I'm sure Ramsey does. And she's asking, of this total number, I believe you said we were over 33,000. How many have recovered? Because the ADPH is releasing that data weekly.
Yes, and they actually just updated that number. It's at 18,866 right now, which I think that's a little over half,
so you
which
said
is good. That's good news.
Over 18,000 have recovered?
Yes, nearly 19,000.
Okay, got it. So I'm not good at math, but yes, that is a little bit. It seems like over half of the 33,000 cases of COVID we have so far. So it's important to note, Sharon, I'm glad you asked that, because it's important to note that these case numbers that we're talking about and that over 33,000 number that you see a lot, that does not include recoveries. That is just a cumulative number of cases. Correct. So that's a good question. I'm glad that y'all are pointing that out. a lot of people questioning about Etowah County. What are we seeing in the Etowah County region?
That's a good question. Let me just pull them up real quick. So we've had just over 500 total cases in Etowah County since the start of the pandemic, which is a pretty low number for a county of its size. It has just over 100,000 people. So you compare that with what we were talking about earlier in Marshall County, and Marshall has fewer than 100,000, but close, 96,000, and has more than twice as many confirmed cases as Etowah, which is slightly larger. Etowah County added 36 new cases today or overnight. And the 7-day average there is 21 cases per day over the last week, which is kind of on the low to middle end in the state.
Got it. I'm going to ask you one question, and then we're going to go back to the map, and I'm going to show you South Alabama, because we did North, so I want to give y'all South Alabama. But a quick question from Terry, and Terry asks, what is the percent of positive cases? Do you have that number, Ramsey?
Yes, I do. It's just under 11% right now. It's 10.9%. So that I think a lot of what the state has said is they want to keep that number under 10 would be ideal. But right now, over the past 2 days, testing has kind of ramped up, but it's still sitting at just in terms of pure testing, about under 7,000 tests a day, something like that. And with the increased caseload, we're seeing the cases go up at a slightly faster rate than testing. So that number has actually increased. It was around 7 last week or earlier this week, as far as percent positive, 7%, and now it's at about 11%.
So I'm bringing you back the map, and we're going to go down and talk about Mobile County and Baldwin County. People I know are getting the itch to go to the beach. It is nearly July, end of June. It's hot here, and everybody's wanting to go south. So let me show you Mobile and Baldwin. Now let's talk about Mobile first, because that is the county that we've had we've had a lot of reporting around. We've talked about several times here on my show, and I know that Mobile was a really hot spot for a while. So what's happening in Mobile County right now, Ramsey?
So Mobile, kind of similar to Montgomery. At one point, it had the worst outbreak in the state. That has cooled off a bit. It had at one point passed Jefferson, which is much larger as far as population and in total cases. Jefferson has now repassed Mobile and is on track to pass Montgomery soon too. Mobile added 52 cases today, right along its 7-day average of 53 cases a day. And while it still has to date the most coronavirus deaths that of any county in the state, that number has also slowed down a little bit. Which is good news in Mobile County. So I think a lot of Mobile's high numbers that we see are kind of left over from when its outbreak was really, really bad. It's still adding a lot of cases, but you would expect a county of its size to add new cases. I think it's nothing out of the ordinary right now going on there, and they've gotten things a little bit more under control.
Now, Baldwin, neighboring Baldwin County, new cases today is 38, total cases 500, and deaths 9. That's a pretty stark difference between Mobile being right next door. So do we know why that is, Ramsey? Why is Baldwin tracking lower than Mobile County?
Sorry, go ahead.
I was just saying, what's happening in Baldwin County?
That's a good question, and it's something that, I've gotten a lot of messages about, and I'm curious about myself, and I really don't know the answer to that. It is strange. You would think, especially, we saw a big spike in cases following the Memorial Day holiday and the reopening of the beaches. And I was really interested in watching Baldwin County because up to that point, they had really low case numbers and hadn't had a bad outbreak. And cases really still haven't spiked there, which is great news. Part of that might be what I was talking about before, where cases are listed by county of residence. So if a lot of people came to Baldwin County for Memorial Day or to vacation at the beach and then went home, and got the virus, that virus case would be counted as their home county, not as a Baldwin County case. So maybe some of that happened. I mean, maybe people didn't transmit at the beach. I don't know.
That's a good point, and that's something that I feel like we've gotten asked multiple times over this, and understandably so, because it is confusing. A question that I'm going to stop this here, bring us back. If you have more questions, I will bring back the map. But question, I'm trying to find who asked it. can't find it at the moment. About hospitalizations. I know that we do not have the county by county hospitalization number at this point, but do we have a total hospitalization number of those over 33,000 coronavirus cases?
Yeah, so we have two different numbers. We have an all-time hospitalizations numbers, which sits at 2,653, which is kind of that's since March 13th, which is, I don't really like using that number because it's just a cumulative hospitalizations number. We also have, though, a current hospitalizations number, which we just set records in this mark yesterday, which is the last time we have data available. There were 693, so almost 700 people in the hospital with coronavirus yesterday, which brings the 7-day average for current hospitalizations to 659. Both of those are records. So we have more people in the hospital due to coronavirus than we ever have at any point in the pandemic right now.
A question that I don't have the answer to, I'm not sure Ramsey will either, but Donna, I think this is important and we'll get this to one of our reporters, but Donna asks, how will the cutting of federal support of testing impact testing in Alabama? Are counties using non-federal funds? I don't have that answer. I will try to get it to somebody who does, Donna. And again, just talking about testing that she brings up, Ramsey, the question that we're getting over and over and over again is, are our numbers high because our testing is high?
That's a great question. It's something that I look at every day. Our testing is slightly up over the last 2 days, but the 3 days before that, it was down. It moves around a lot. I think that has to do with the way that testing is reported. But if you look at the last 7 days, we've averaged under 7,000 tests a day. And the percent of those tests that comes back positive is going up over that time. So I think that more testing is going to find more cases. That's absolutely true. But I also think that cases are going up at a faster rate than tests. So testing does not explain why cases are up, if that makes sense.
It does. It does. And thank you so much, Ramsey. I'm going to let Ramsey go because he's got a lot of work to do and he's got a lot of data to keep us updated on. But if y'all have questions, I'm sure he would be happy to answer them. So would I. So leave them in the comments. We'll get to them. Thank you so much, Ramsey, for giving us a little bit of your time and your brain. And everybody else, we will see you next week. Have a safe and good weekend.
Have a good weekend.